What are the treatment options available to all of us in the tinnitus community?
Sure. So, I, as a physio, the treatment options are, I always will treat, well, when I see a tinnitus patient, I will assess their jaw, assess their neck, and assess their mid and lower back, okay? And what I'm looking for is there an on-off generally, okay? And by that, what I mean is that I can do certain mobilizations, certain techniques, certain movements, that sort of thing, to see if I can change their tinnitus. Can I switch it on and can I switch it off, okay? And if I am able to do that within the session, then I will sort of conclude that their tinnitus is coming from that area. Then when it comes to treatment, I will see, you know, is there anything coming from the jaw? Is there anything coming from the mid back? And may get rid of those areas completely, or most of the time I treat all three areas in one session. Okay, and treatment specifically will, there's a range, you know, I will, if you've got lots of inflammation in an area and you're swollen a little bit, or you've got lots of pain in an area, then I have a laser that I use. So infrared light is basically takes away the chemicals of inflammation away. And before you feel pain anywhere, you have these chemicals of inflammation. You have something called oxidative stress, free radicals, that sort of thing. So this laser takes that away. You can't feel anything with it. It's actually, my patients always report that that's the best part of treatment because it's nice. So there's the laser. I also do something called dry needling, which is the same needles as acupuncture needles, but it's based on Western medicine rather than Chinese. And it's much simpler than acupuncture. But what I'm basically doing is the muscles that I spoke about earlier that are tight and the length of the muscles has shortened. What also happens on a microscopic level is that the muscles are meant to be in straight lines, okay? And they basically contract together like this. And then when they are straight, they can then effectively relax. Now, when someone has spasm or tight muscles, the muscles are always contracted, and sometimes they can be twisted around each other as well. So when you're trying to use that muscle, you just can't come out of there. Now, when you stay in that position, you develop a knot. So the knot that we're always massaging in here, you can develop them in your face as well, okay? And in the middle of these twisted fibers in your muscle, you have a knot there, okay? And so what I do is through the needling is put the needle into that knot so that it can allow the fibers to separate and more importantly, get to a point of relaxation and increase the blood flow into that area so that they are able to be pain-free, less inflammation in that area as well, and use that muscle in the way that they were supposed to use it. The other thing that I do is something called mobilizations as well. So that is, I can do that on your jaw, neck, well, your whole spine really. And the whole point of mobilizations is where you are moving the joint. So it's not like chiropractic treatment or osteopathic treatment where you are cracking and it's grade 5 manipulation. This is mobilization, so it's just shy of that. And the difference is that I am working in the joint's normal range of movement, whereas when you're cracking, you're taking the joint out of its normal range of movement. Yes. I don't think one is better than the other, it's just that this is what I do. Okay, and with mobilizations, you can increase blood flow, you can stretch the adjacent muscles around there and just improve the health of the joint. Okay, now when it comes to TMD, because the disc is sitting there as well, not only are you improving the health of the capsule that is around the joint, but you're improving the circulation that and the nutrients that the disc needs as well. Okay, and by doing these mobilizations, when I told you about how you've got the ligament that attaches over to the ear, when I do the mobilizations to the side, I'm directly working on the muscle that I said is attached onto the disc. And if I can increase that length, it then allows the malleus to sit where it needs to sit and I guess really vibrate the way that it needs to vibrate and take away the symptom of tinnitus. Then I will strengthen the neck and strengthen the back, improve posture, which most physios do as well. So